Hey everybody, it is great to be here today. I feel like a champ, actually, and this is a perfect setting for the upcoming fight. But really what's happening in our country today is we actually are in another fight, and it's the fight against opioid abuse and the opioid epidemic. This is a huge problem in our country right now, and just to quote a couple of important statistics, we know that chronic pain is a $600 billion problem. We also know that there are over 18,000 deaths per year from prescription opioid overdoses. And we know that these drugs are gateway drugs to other more serious addiction conditions like heroin. And so this is a big problem. It's never been so significant as it is today. Again, the most amount of deaths annually, about 52 people a day are dying from this opioid epidemic. And we know that we are a profession that needs to lead the solution. So we're going to talk about what some of those solutions are. Well, first and foremost, we know that one of the most important solutions is chiropractic. Chiropractic is an evidence-based solution that helps to reduce both acute and chronic pain. I think it's also important to note that the American College of Physicians just came out with their clinical practice guidelines. And remember, clinical practice guidelines are the highest level of scientific evidence. So they came out with their clinical practice guidelines for the treatment of acute, subacute, and chronic low back pain. And here's what they said. For any patient experiencing acute, subacute, or chronic low back pain, the only treatment that was recommended for all three categories of low back pain by the American College of Physicians was spinal manipulation. That's never been done in our history, where a medical organization has published a clinical practice guideline recommending chiropractic as the first line of defense for treatment of low back pain. And one of the important elements to understand is that for chronic back pain specifically, the guideline recommended that patients and physicians should initially select non-pharmacologic treatment. So that's a big step for us as a profession, but more importantly, it's a big step for the public that we serve. So what are some other evidence-based tools that we can use to help the population at large? Well, as you can see, I'm in BioFreeze green right now, one of my favorite colors. And BioFreeze is actually an evidence-based opportunity and alternative for pharmacologic intervention. Most people may not realize this, but over the last several years, there have been studies, some of which we've actually done in our Clinical Research Foundation, that has demonstrated that BioFreeze is more effective than TENS, and it's also less costly to the system. But BioFreeze is actually preferred by patients. 9 out of 10 patients prefer BioFreeze over ice. And the effect of BioFreeze actually lasts longer. So it's a great evidence-based solution that you can send your patients home with so they can actually help reduce their pain. And reducing pain, it helps to build trust with the provider, that improves compliance, and ultimately that patient will get a better outcome through their course of care because you've demonstrated to them that actually you have reduced their pain early and often. And again, BioFreeze is it's a great tool. We use it in our practice literally every single day, and it's a great tool to use for your patients to help them understand how they can actually use non-pharmacologic approaches to reduce their pain. I think another important thing that the Performance Health Company has done is develop this amazing campaign, saferpainrelief.org. And if you go to this website, you'll see tons of marketing resources. You'll see a toolkit. You'll see great content for you, your practice, as well as the community. It's a great opportunity for you to use educational content to inform the public and other healthcare providers that there are safer, more effective, more evidence-based solutions than what they're currently utilizing. I think it's also important to understand, during this time of the opioid crisis, that the other drugs that patients are using, NSAIDs, acetaminophen, those drugs, first of all, acetaminophen has been shown not to be effective for the treatment of low back pain. And NSAIDs, the FDA came out about 2 years ago and said, if you're taking NSAIDs in the healthy population, you're actually going to have an increased risk of heart attack and stroke. So being able to use an evidence-based solution like BioFreeze is a great way to reduce not just the opioid issue, but also reduce any potential adverse reactions that a patient might have by taking an NSAID. I think it's also important to understand that in addition to BioFreeze, there's other great evidence-based tools that we can utilize in our practice to help reduce pain. Kinesiology taping has been shown as a great way to reduce pain. Utilization of exercise, and patients can do exercise with the great CLX band. I don't know that I have one handy, but the CLX band, oh, here we go. stepping out of camera for a sec, but the CLX Band is a great way to provide a home exercise program for patients that they can do exercise, and exercise again has been shown to reduce pain. It's also a great tool to use in clinic. We use these literally every day with probably, I don't know, 95% of our patients. It's just a great tool to use that again will help improve function and also reduce pain. So there you have it. We've got a crisis. We've got evidence-based solutions to resolve this crisis. Let's get out there. Let's create a movement, a safer pain relief movement to drive improved outcomes, less deaths, and a better overall result for the population that we serve. Thanks so much.